Good morning, and welcome to Gen Z News. I'm Amelia Carter, and today we're addressing a critical issue that demands our attention: the hidden challenges of long COVID, particularly its impact on the brain, and why our current reliance on blood tests is failing patients, leading to misdiagnoses and prolonged suffering. This is a pressing public health concern, and it's time we confront it head on. Let's dive into the science, the stakes, and what needs to change. To grasp the scope of this issue, we first need to understand the blood-brain barrier, or BBB. The BBB is a protective shield of specialized cells that regulates what can pass from the bloodstream into the brain. Its primary role is to safeguard the brain from harmful substances, including viruses, but it is not impenetrable. During infections like COVID-19, this barrier can become compromised, allowing the virus to infiltrate the brain. This brings us to long COVID, a condition affecting millions worldwide. For many, the initial infection subsides, but symptoms persist for months, sometimes years. Neurological symptoms such as brain fog, chronic fatigue, headaches, and dizziness are alarmingly common. Research suggests that SARS-CoV-2, the virus behind COVID-19, can enter the brain, often through the nasal cavity via the olfactory nerve. A 2021 study published in Nature Neuroscience confirmed the presence of viral RNA in the brain tissue of deceased COVID-19 patients, even when it was undetectable in their blood. This indicates that the virus can take up residence in the brain, potentially lingering long after the acute infection has passed, contributing to the debilitating symptoms of long COVID. Now, you might assume a blood test would reveal whether the virus is still present in the body. Unfortunately, this is where our diagnostic tools fall short. Blood tests, such as PCR or antigen tests, are designed to detect active viral replication in the bloodstream. During the early stages of COVID-19, this can be effective. However, in long COVID, the virus may no longer circulate in the blood. If it has sequestered itself in the brain, the blood-brain barrier often prevents it from re-entering the bloodstream in detectable amounts. As a result, a blood test can return a negative result, even as the virus, or its effects, continues to wreak havoc in the brain. The evidence is clear. A 2022 study in the Lancet Neurology found that long COVID patients with neurological symptoms frequently showed signs of inflammation in their cerebrospinal fluid, but not always in their blood. Additionally, a 2022 Nature study discovered viral RNA in the brains of patients up to 230 days after their initial infection, yet blood tests often failed to detect it. This discrepancy reveals a critical flaw in our diagnostic approach. Blood tests simply cannot reliably capture what's happening in the brain, leaving countless patients without answers. This failure has profound consequences, chief among them the risk of misdiagnosis. When a long COVID patient receives a negative blood test, their symptoms, brain fog, fatigue, headaches, may be attributed to other conditions such as chronic fatigue syndrome, migraines, or even psychological disorders like anxiety. A 2023 survey published in BMJ Open revealed that many long COVID patients felt dismissed by healthcare providers, with some being misdiagnosed with mental health conditions when, in reality, their symptoms stemmed from neurological effects of COVID-19. The overlap between long COVID symptoms and other illnesses complicates matters further. Brain fog can mimic chronic fatigue syndrome. Headaches might be mistaken for migraines. But if the root cause, whether it's viral persistence in the brain, lingering inflammation, or immune dysregulation, goes unaddressed, patients are denied the care they desperately need. Worse still, some may not receive a diagnosis at all, left to navigate their suffering in isolation. This is not just a medical oversight, it's a systemic failure that undermines trust in healthcare and exacerbates patient outcomes.